It pops.
It just pops out.
Yeah, it pops.
I'm Scott.
Oh.
I'm Scott.
I'm Danny.
Hey, Danny. Nice to meet you.
Liz says that the channel she's right there.
Thank you. Appreciate it. I worked under Bill from 99.
Were you the one that helped me out with the tripod? I forget what it was.
Oh, was it the full one for the, that was,
Yeah.
oh wait, no, I didn't do the tripod, I got the audio source.
That's right, yeah.
Yeah.
We just had to like make it work.
Like, hey, I think we got some audio, wait,
Yeah.
let's do this, boom.
It looked good. It was fine.
Cool. Well, I'm glad to help you.
Yeah, that was awesome.
You know, while I stand here, I don't have my mask on, just in case I go off. Are you okay with?
Yeah, I'm fine,
long as
yeah,
I-
yeah.
Okay.
We generally, when we're in the room, because it's mostly people that are
Drifting
taking,
in and out? Yeah.
taking you know, they're doing the right thing. We usually don't have them on, but since we're gonna have such a large volume, we just thought we'd
I heard the riff raff.
do everything, so,
That's good.
just to help everyone.
Yeah, just want to respect your rights and privileges.
Thank you.
Thank you.
Mine's sitting in the center console in my car. I mean, I promise you.
Well, then you're gonna bake off the COVID, so it'll be ready for when you hop back in.
All right.
Oh, wait, I'm over there. I apologize. I'll just take it there, too. Yeah, I'll be over here.
The mic's not in. The mic.
On the phone?
I just saw it there.
We started it.
The broadcast is now starting. All attendees are in listen-only mode.
All right, it looks like we have all the technology in order here, so we'll get started. Good afternoon, everybody. Welcome to the Maricopa County News Conference for June 5th. My name is Fields Mosley. I am the Communications Director here at Maricopa County, also considered the lead PIO, or Public Information Officer, for the Unified Command Center right now, which includes Public Health and the Department of Emergency Management. I'd like to thank all the reporters who are joining us live via the webinar, and we have a TV camera in here as well, streaming this live for your benefit. Also like to thank members of the public who might be joining us now via Facebook or YouTube. We appreciate you being here and allowing us to get you some information about the situation here in Maricopa County when it comes to the COVID-19 pandemic. So I think I should first acknowledge we all know it's been a difficult week in our country, also in our community, and we appreciate that there's been a lot going on for the members of the media, the members of the public, a lot of emotions as well, with, of course, the COVID-19 pandemic still running underneath it all, and we have a lot of information to share today about that. I want you to know that county agencies continue to provide services. They're also working on an array of issues related to the pandemic, and this is very important. Today, Maricopa County Public Health Executive Director Marcy Flanagan will provide analysis, some context about our case counts in Maricopa County. She's also going to revisit some of the straightforward information on what you can do to mitigate the spread of COVID-19 within our community and, of course, with your families as well. Also, we released the latest case numbers from the Maricopa County Jail System yesterday. Through a successful protocol, EMCSO and Correctional Health Services, which is the medical provider within our jail system, that is a county agency, Correctional Health Services. They've been able to mitigate the spread of COVID-19 among the inmate population and have had quite a bit of success since March. This has been in place. However, test results pushed our numbers from 6 last Friday to 30 as of yesterday late afternoon. So we wanted to acknowledge that. This is a very small percentage of the total jail population, which is about 5,000 right now. However, it is something we are watching very closely. There is a very strict protocol in place, and I have people here today who are able to talk about that in detail if you have questions about that as well. So I have Custody Chief Barry Rosca from MCSO, also have Tanya Lynch, she is the Director of Correctional Health Services, and the Medical Director of Correctional Health Services, Dr. Grant Phillips. They are available to answer questions. We also have Joanna Molina from Public Health with us once again, so when we get to the question and answer period, we will answer those questions in Spanish as well for the benefit of our Spanish-speaking audience and any of the Spanish language television or radio stations who are with us. So before we get started, just a few things logistically. If you're logging in, it's the first time you're joining us as a reporter on this call and you want to answer or ask a question rather, you have to unmute yourself. We cannot do that from our end. You will be allowed into the queue. You virtually raise your hand. We allow you in there, and then we will let you know that we have unmuted your microphone. If you're having difficulty with the GoToWebinar software, please try to make it work on your end. Don't keep clicking on raising your hand. If it's not working, log out and log back in, and that usually resolves the problem. But that is not something we can fix on our end here with GoToWebinar. So with that, I'd like to ask Marcy Flanagan, our Executive Director of Maricopa County Department of Public Health, to make a short presentation today.
Thank you, Fields. I'm Marcy Flanagan, M-A-R-C-Y, Flanagan, and I'm the Executive Director with Maricopa County Department of Public Health. So in public health, we have been watching the trends of COVID-19 in our community to help us understand how social distancing and other important public health interventions are affecting the spread of disease in Maricopa County. And we know that from science, when individuals start to interact more, chances of getting infected increase. So we expected to see more COVID-19 infections several weeks after social distancing was relaxed. In public health, we have to balance allowing people to work and put food on the table while minimizing the spread of COVID-19 in our community. However, we are starting to see some indicators that the number of COVID-19 cases is increasing in Maricopa County. And we have enough information to know that these increases are not due to just an increase in testing that is occurring. Over the past 4 days, we have received reports of the highest number of cases we have ever seen, averaging nearly 500 cases per day. This is in comparison to the nearly 200 cases per day we were seeing previously. Although we typically see more cases a few days after the Saturday testing blitzes, these numbers have been much higher than other Saturday testing blitzes. Additionally, hospitalizations for COVID-19 have increased the past week, and this would not be affected by the availability of testing. We're also seeing higher numbers of hospital beds that are occupied by COVID-19 patients, with fewer ICU beds available than previously. We know this from real-time data that is reported to us from local hospitals. It is important to note, though, that Maricopa County hospitalization rates EpiCurve is still showing a slight downward trend. This is because this only represents Maricopa County, but that it also has a typical couple of weeks, 2 weeks lag time behind our case count numbers. And then lastly, the percent of positive cases has also begun to increase. So even though an increase in testing could be part of the reason the case counts are climbing, all of these indicators together tell us there's an increased spread in the community. So here's what we need people to know. First, we have COVID-19 circulating throughout our community. Everyone needs to keep at least 6 feet of social distance between yourselves and others whenever possible. And when that's not possible, please wear a cloth face mask when you leave your home. If you can avoid going out, you should do so. The less time you spend around others, the lower your potential of exposure is. People who are at higher risk of COVID-19, like those over the age of 65 and with chronic medical conditions, should absolutely avoid going around others outside of their household whenever possible. But remember, even if you are not a person in that high-risk category, you are just as likely to become infected with COVID-19. You are just less likely to experience severe illness. So be mindful of everyone in those high-risk groups. If we reduce exposure of ourselves and practice social distancing, we can reduce the risk of exposing people that we care about and who are at much higher risk of severe illness. We know that some Maricopa County residents have received phone calls from someone stating that they are from the Arizona Department of Health Services and are being contacted because they were in connection with someone that tested positive for COVID-19. We have confirmed with ADHS that they are not making these phone calls. We are trying to find out the source, but in the meantime, if you are a confirmed contact of someone who was exposed and is a positive COVID-19 case, you would receive a phone call from Maricopa County Department of Public Health that will tell you what to do next, whether you should quarantine yourself and stay away from others, and for how long. We will not share names of other confidential information of cases with anyone that we call. And if we don't reach you and leave a message to call a number back from Maricopa County Department of Public Health, you were likely receiving one of these calls that were not accurate. So finally, make sure you check on your high-risk family members, friends, and neighbors, helping them get access to groceries, medications, and other necessities that can help them stay safe during these uncertain times. And share the senior helpline number, which is 602-264-4357, which offers food delivery box and other support. Thank you.
Thank you so much, Marcy. We appreciate that. So some good information there and a little context about the numbers we're seeing here in Maricopa County. At this point, we will open it up for questions from members of the press who are online right now. And Ron, do we have anybody on the line?
Fields, right now there are no raised hands. No questions waiting.
Okay.
Our first question has come in. Ann Ryman.
Okay.
Your mic is unmuted.
Hi, thank you. I noticed the hospitalizations among long-term care residents jumped significantly from like May 26th to May 27th by almost 100 people. I'm wondering if you could talk specifically about what you're seeing about the hospitalizations among long-term care.
So, and we don't have those numbers in front of us right now. We're happy to get you some information about that from Public Health. If you want to email us here in the Joint Information Center, I'll get you some information on that shortly after this press conference is over today. I apologize for that, but that's we just don't have those in front of us right now, so we'll have to get that to you later. Do we have another question, Ron?
Yes, Fields. Our next question is from Tom. Tom Scanlon, your mic is open.
Yes, thank you. Can you provide the number of hospital beds occupied by COVID-19 patients and ICU beds, and also the number of regular beds and ICU beds available, please?
Tom, I think that's another data question. We weren't quite prepared to go that deep in the weeds here at the press conference today as far as responding to that, but we're happy to give you the numbers we have. Most of the hospitalization numbers are listed on the website, I believe. If you haven't looked at the report today, please take a look at that, see if that answers the question. If you don't, get a hold of us here in the Joint Information Center, and we'll try to clarify anything. If it's not a data point that we track, we can talk a little bit about that, but most of the data we're tracking, we are presenting in that report that's on the website every single day. Ron?
Our next question is from Melissa Blasius. Melissa?
Can you hear me?
Yeah, we can hear you, Melissa.
Okay. Thanks for doing this. I'm curious about the contact tracing process and how that's going. Are you currently able to track all of the new cases in Maricopa County that are coming in on a daily basis? And if not, how close are you to staffing up to be at that level?
Okay, thanks for the question, Melissa. So the question is, contact tracing, how is it going? What is our staffing level now? Obviously, we presented 2, maybe 3 weeks ago now, talking about our plan to deliver an adequate amount of contact tracing. Marcy Flanagan will take this question and elaborate on that.
So our contact tracing efforts continue. Such as we have from the beginning of this outbreak in our first case, we do contact every positive case, and we are still doing that. We are in the process of hiring 102 staff members to be able to investigate up to 500 cases by July 1st. 42 have already started, and 58 have been offered positions. For our contact tracing, we also have contracted with AZ211 to reach out to close contacts, and that contract is already in place. So we are contacting and investigating every case that comes in.
La pregunta es, con todos los casos nuevos que han surgido, ¿cómo se le da seguimiento si tenemos la capacidad para darle seguimiento a todos estos casos? La respuesta es que al momento hemos estado contratando más personal. Se intenta contratar a 102 personas más. Al momento 48 han aceptado los puestos y estamos dando seguimiento a cada uno de los casos que resulta positivo. También se ha hecho un contrato con AZ211, la línea telefónica 211, para que también ellos puedan darle seguimiento a las personas que estuvieron en contacto con personas infectadas.
Thank you, Joanna. Thank you, Marcy, for answering that question. Thanks, Melissa, for the question. Ron, do we have somebody else?
Yeah, the next question is from Bob. Bob Christie, your line is open.
Thank you. This is probably for Ms. Flanagan. So I guess the context that I'm looking for is, we've seen this large jump in cases and hospitalizations in the last week or so that started about 10 days after the stay-home order ended. If this continues, are we in trouble in a week, in a month? That's the context I'm looking for, is where you think we are if this rate of increase continues. In a week or so, are you concerned about your healthcare system? In 2 weeks, are they overwhelmed? That's where, that's the broad question I'd like to have Ms. Flanagan answer, please.
Okay, so some perspective on where the numbers are taking us and how much capacity we have in the healthcare system. Marcy Flanagan will elaborate on that.
So absolutely, one of the best indicators for knowing that we need to be very vigilant about the efforts we are doing with social distancing is looking at those hospitalizations and what the bed availability is. At this point, even though we have seen an increase in hospital utilization rates, it's not to a point where they are doing into their critical care or surge capacity. So when we get to that point, and I can't tell you if that'll be in a week, in 2 weeks, in a month, if individuals follow all the recommendations we're putting out there, which are social distancing whenever possible, wearing a cloth face mask when you go out in public, and going out whenever only necessary, I believe it could take us quite a while to get to a concerning level. But at this point, we're not there yet.
La pregunta es que con el gran número de personas que se han resultado positivos ahora, si debemos estar preocupados de tener la capacidad en los hospitales para atender a tantas personas enfermas. La respuesta es que aunque hay un incremento del número de casos en los hospitales, también hemos sabido que hay espacio todavía y no nos podemos preocupar de decir que no tenemos la capacidad para atender a las personas que se enfermen. No tenemos nosotros la posibilidad de determinar si en una semana o un mes esto pudiera cambiar, pero sí podemos hacer cosas que están en nuestras posibilidades, entre ellas el distanciamiento social, el usar una mascarilla cuando uno sale y no puede estar 6 pies de distancia de unos de otros, y sobre todo quedarnos en casa si no hay necesidad de que tengamos que salir.
Thank you, Bob, for that question. We appreciate it. And some good perspective there. Obviously, none of us have a crystal ball, but our epidemiology team is watching the numbers every single day. So, and we know they're doing the same at the state level as well. So, Ron, do we have anybody else on the line?
Yes, sir. Ann Ryman has a follow-up question. Ann, your mic is unmuted.
Could you give us an update on the RFP that went out for the COVID-19 testing in the long-term care facilities? And have you hired anyone or started anything along those lines? And how would a long-term care facility, I mean, what do you envision for those facilities as far as that RFP is concerned?
Okay, so thank you for the question, Ann. The status of the RFP, which is to implement testing across all long-term care facilities in Maricopa County, or most of them at least, and and what will that look like? So Marcy can elaborate on that.
So just a reminder that ADHS has already begun testing in long-term care facilities that are Medicaid licensed facilities. Those are just over 140 statewide in Arizona. The RFP that we put out in Maricopa County closes on June the 8th. We have gotten some good response. What we expect the next steps after that would be is we put those contracts in place, and we've already been working with all long-term care facilities as soon as they have one positive case. We work with them on infection control and how to cohort and isolate individuals, and we will continue to do that. What these contracts will allow is that we're able to do that more broadly and quicker. So we're excited for these to get in place, and we expect the same work to continue, but just to continue more broadly and quicker in our community.
Bueno, la pregunta es, ¿cuál es la actualización para contratar a las agencias para hacer pruebas de COVID-19 en los centros de cuidado médico de largo plazo? Bueno, acaba de mencionar que el Estado ha empezado a hacer estas pruebas ya, en algunas que ya tienen la licencia que se requiere a nivel federal. 140 de esos sitios ya se están realizando las pruebas o se han hecho las pruebas. El 8 de junio es cuando expira la ventana para que agencias puedan someter una propuesta a Salud Pública al Condado Maricopa para ver cómo harían estas pruebas en más centros de cuidado médico de largo plazo. Tienen hasta el 8 de junio para hacerlo. Lo que también queremos mencionar es que al momento se están haciendo estas pruebas, estamos trabajando con estos centros, solamente que queremos expandir la capacidad para hacer más pruebas y más rápido.
And thank you for the question. Ron, do we have somebody else?
Sure. Tom Scanlon has a follow-up. Tom,
Okay.
your mic is unmuted.
Yes, I've asked this several times, and the state is putting out daily ICU and inpatient bed usage, and I don't understand why the county is not also doing the available beds and bed usage, and it sounds like you're in contact daily with the hospitals, so I don't understand why that information is not being provided.
Tom, let me see if I can find out a little bit. So you're asking why we don't have hospitalization. We certainly have hospitalization rates. Let me see if I can get some more information on this. Marcy Flanagan will try to expand on that a little bit more. Go ahead.
So all of our information is reported to us on a daily basis through an EM resource, and that's what hospitals are reporting through, and that's all sent up through the state, and that's how we're seeing our daily numbers and watching them. So the information you're seeing on the ADHS website is the same information that we're using to see what our capacity is locally.
La pregunta es, ¿por qué no se ha puesto el número de camas disponibles en los hospitales en el sitio de internet del Condado Maricopa? Y la respuesta es que el Estado ya tiene esa información que está disponible también en su sitio o en su página, y esa es la misma información que Salud Pública confía y es la misma que utiliza. Entonces esa información ya está publicada en el sitio de internet de lo que viene siendo el Estado de Arizona.
Thank you, Marcy, for the answer. Tom, you had me stumped there. I hadn't heard that one before. Okay, so Ron, do we have somebody else with a question?
There are no additional questions waiting at this time.
All right. Well, with that, I think we'll close out this press conference for June 5th, unless somebody joins us in the next couple of seconds to ask a follow-up question. For those of you who had asked those more detailed data questions, we will certainly work to get you answers this afternoon. If you go ahead and email us at caomedia@maricopa.gov. I'd like to thank Sarah Hill for joining us today and providing the sign language interpretation as well, and Joanna Molina always providing her services through public health and interpreting in Spanish. So thank you, everybody. We hope. What's that, Ron?
There are two additional questions that have come in.
I spoke for too long. All right. Thanks, Ron. Who do we have?
First up, Lauren Castle. Lauren, your mic is unmuted.
Hi, I have some questions concerning the Sheriff's Office and Correctional Health Services.
Okay.
My first question was, the news release from yesterday stated inmates were receiving masks, and I wanted to know how many masks does each inmate receive?
So Chief Rosca is here, Chief Barry Rosca from the Maricopa County Sheriff's Office. He'll take that question.
Good afternoon. Thank you for the question. Upon entry into our jail system, all of our community members are issued a mask at that time, and then if not released and then retained in our custody for a longer period of time, at a point that they ask or request for a replacement mask, it's given to them, and that we work with our officers and the supply level that we have to make sure that we're always constantly having available for our community members that are incarcerated a replacement mask when they need it, or when it becomes rather obvious that it needs to be replaced, and we just issue it to them then. Thank you.
La pregunta esta era para Salud Correccional y para la Oficina del Alguacil del Condado de Maricopa. ¿Cuántas mascarillas reciben los presos una vez que son detenidos? La respuesta es que una vez que entran, se les da una mascarilla y ya sea que sean retenidos, que se queden ellos dentro de la cárcel, entonces se les reemplaza cuando ellos necesitan. Y también se les da seguimiento. Si hay más necesidad de cambiarla, también se cambian.
Lauren, thank you so much for the question. Ron, you said we had two questions? Did we lose you, Ron?
Lauren? Sorry, I'm back.
Okay, good.
Lauren, you had a follow-up question?
Yeah, I had a question about a different topic, still for the Sheriff's Office. The ACLU has asked the Sheriff's Office to test all inmates and publicly release data. And I wanted to know, has the Sheriff's Office thought about this concern?
So I think that's more of a medical question as to whether or not we choose to do more broad testing in the jails. I think it's important to understand how and why Correctional Health Services is doing testing inside the jails right now. And you know, it's been a point of discussion for quite some time. So Dr. Phillips, I think, is best suited to answer that question. So I'd ask him to come forward and talk to you about that.
Hi, my name's Dr. Grant Phillips. That's spelled Grantphillips. And when answering the question about testing of inmates for COVID-19 in the jails, this has been an evolving situation, just like it has been in the community. And we at Correctional Health Services have been working very closely with our partners at MCSO, as well as the Maricopa County Department of Public Health, to formulate a response with the same common goal, which is to keep people healthy, to provide excellent health care, and to prevent the spread of COVID-19 in the jails. And so when talking about how we're deciding to test patients and what we're doing for the patients, we started a couple of months ago with a supplemental screen. When inmates come into jail and they're arrested, we ask them questions about symptoms. We check them for a fever. We check to see if they have symptoms of cough, shortness of breath, fever, chills, body aches, things like that. We ask about exposure history to COVID-19, and we ask about travel history. We put those individuals who are at higher risk based on that questionnaire and based on history and physical exam into medical observation housing. That's also known by the CDC as medical isolation housing. And we keep them separated from other people while we're testing them and monitoring their symptoms along the way. As we've evolved over time to identify people who are at high risk for COVID-19, we've come to realize, as we've seen these positive cases build up, that we also need to do contact tracing within the jails. And that's where that close partnership with MCSO comes into play. When we have patients who are who have been found to be in close proximity to individuals who test positive for COVID-19, we put them into, we request special housing. We put them into medical quarantine housing where we can observe these individuals. And as of now, we are testing every individual in quarantine housing and identifying with the full realization that some people are going to be positive for COVID-19 and not have any symptoms at all. That's something that we've been hearing from the CDC and Department of Public Health as well, that many, many people are out there with probably infections of COVID-19 and they don't have any symptoms at all. And we're taking close precautions for those individuals as well. As soon as we identify that someone is positive for COVID-19, even if they don't have symptoms, they are also going to be put in medical observation housing.
La pregunta fue que si se ha considerado hacer pruebas a todos los presos. ¿Cuándo empezaría eso? Si lo han empezado a hacer. Bueno, las pruebas de COVID-19, se está cambiando todo lo que sucede con esta pandemia diariamente, ¿no? Y estamos trabajando muy de cerca, tanto el Departamento de Salud Pública, el Departamento de Correccionales, del alguacil y también de los que brindan cuidado médico dentro de las prisiones para mantener a la población saludable y evitar la propagación de COVID-19 dentro de esa población. Cuando las personas se arrestan, se les revisa de los síntomas que pudieran presentar. Se les hace un cuestionario, se ve si tienen síntomas de tos, fiebre, dolor, se les hace un examen médico y se mantienen en aislamiento mientras se esperan los resultados de esos exámenes, porque pueden ser de alto riesgo. También se les da seguimiento a los contactos de las personas que pudieron haber estado expuestas, ¿no? Y eso es muy importante porque sabemos que muchas personas pudieran estar enfermos con COVID-19 dentro de la prisión que no presentan síntomas, porque eso también sucede. Hay personas que son asintomáticas. Entonces se ponen en cuarentena, en aislamiento y se esperan los resultados de esas pruebas.
Thank you so much, Lauren, for the question. Ron, do we have anybody else with questions?
Fields, we have one last question. Melissa Iglesias, your mic is unmuted. Hold on. Melissa, your mic is unmuted.
Hi, guys. This is also a jail question, if you don't mind. When you talk about it went from 6 to 30, have you guys been able to trace why it increased? Was it a inmate that had come in and that it had spread that way, or has it come in from correctional officers at the jail? And in addition, what are your concerns bringing in all of these? I know over the weekend there was quite a lot of protesters who came in, and your concerns about possibly the protesters having COVID-19 and spreading it fairly quickly.
All right, so it's really about spread and how we're tracing it inside the jails, but also some of the protocols that are in place as people come into our jails. Obviously, and before I have Tanya Lynch come up, I mean, jails are it's a cyclical environment. You have people that come in, and we have most people that spend very little time in the jails, but they are put through the intake process, and is there a chance of exposure there? So Tanya Lynch, the Director of Correctional Health Services, will take that question.
Good afternoon. I'm Tanya Lynch. That's T-A-N-I-A, Lynch, L-Y-C-H. I'm the Director of Correctional Health Services. In responding to your question, first we know that COVID-19 affected all 50 states in the United States and abroad. Also, we know that it's in the community. We know that if it's in the community, it's also in various facilities because many individuals are asymptomatic. Now, with any pandemic, one thing that we want to do that is of importance is contact tracing. We have implemented that among the individuals that have been exposed to those that were positive. Right now, we have completed at least over 2/3 of the individual that has been exposed. And we will continue to implement this effort in an effort to contain the disease.
La pregunta fue que si de 6 a 30 presos subió el número de casos de COVID positivo, cómo fue que se propagó, que se identificó el inicio de esa propagación y también pues con tantas protestas que existen, la gente que es detenida también con el riesgo de enfermarse. Y la respuesta es que, pues obviamente, COVID-19 está en los 50 estados, está en todas partes, e incluye, estamos en la comunidad y va a encontrarse en todas partes. Entonces, está en la comunidad y muchas de esas personas son asintomáticos, entonces no están presentando los síntomas y están quizás propagando COVID-19. Entonces, al momento, en 2/3 se han hecho las pruebas que han estado expuestos y se están esperando los resultados de COVID-19. Es una forma de darle seguimiento a cada persona que pudo haber estado en contacto con una persona infectada con COVID-19 dentro de la cárcel.
All right, Melissa, thank you so much for that question. And you had asked, I think specifically about whether it was, where did they get it? Who were they exposed to? We can't talk about individual cases, but I think in general you could say in some of these cases, and Tanya Lynch and Dr. Phillips both alluded to this, that once they found out somebody was positive, obviously they can contact trace around those people and they can determine where that started. In other cases, that might be a little bit more difficult, but that's being implemented, and all those people, as they said, that are potential contacts are they are first quarantined and then they are tested. So that's in the process, and MCSO and Correctional Health have been very nimble about this. They've altered their plan, and as the numbers have grown, they have implemented more testing as well. So that will continue to expand as needed. Ron, do we have anybody else on the line at this time?
There are no more questions.
All right. Well, with that, I already said my thank yous earlier to Sarah and everybody else for joining us today. Thank you so much. I hope everybody has a great weekend. We'll certainly send you out a notice if we're going to do this once again next week. Thanks for being with us.